Welcome to DermWire News, powered by DermWire.com. DermWire News for Smart Speaker is made possible with advertising support from Ortho Dermatologics. I'm Paul Winnington, Editorial Director for Practical Dermatology magazine. Individuals with severe eczema may be at greater risk for heart attack, stroke, and atrial fibrillation, British researchers report in BMJ. Specifically, individuals with severe eczema had a 20% increased risk of stroke and a 40 to 50% greater risk of unstable angina, heart attack, atrial fibrillation, and death from heart disease. This group also had a 70% increased risk for heart failure. These risks remained after the researchers accounted for such factors as weight, smoking, and alcohol use. Researchers note that this was an observational study and there is no proven cause and effect relationship. In an accompanying editorial, Dr. John Ingram, a consultant dermatologist at Cardiff University in Wales, writes that the new study makes the case for targeted screening of standard CV disease risk factors. UCB's Cimzia, or certolizumab pegol, is now approved for adults with moderate to severe plaque psoriasis. The FDA has approved extending the label to include the new indication. The approval makes Cimzia the first FC-free, pegylated anti-TNF treatment option for this indication and marks the entry of UCB into immunodermatology. The approval also follows a recent FDA label update for Cimzia in pregnancy and breastfeeding that provides essential information to healthcare professionals and women. In Phase 3 clinical trials in plaque psoriasis, Cimzia demonstrated statistically significant improvements in efficacy endpoints at week 16. A clinically meaningful response was maintained up to week 48. The trials enrolled over 1,000 patients, of whom nearly one-third had prior biologic exposure, and confirmed the durable efficacy up to 48 weeks and safety of Cimzia in the treatment of adults with moderate to severe plaque psoriasis. According to the updated label, the recommended dose of Cimzia for adults with moderate to severe plaque psoriasis is 400 milligrams, given as 2 subcutaneous injections of 200 milligrams each every other week. For some patients with body weights less than or equal to 90 kilograms, Cimzia 400 milligrams, given as 2 subcutaneous injections of 200 milligrams each, initially at weeks 2 and 4, followed by 200 milligrams every other week, can be considered. Thank you for listening to DermWire News, powered by DermWire.com. This editorially independent program is supported with advertising from Ortho Dermatologics.